So we're going to try and gain back some time in this session because I know this next piece is between you and the cup of coffee to get us through the last half where there's some really great content to come through this afternoon. Hopefully many of you attended the Building Evidence workshop that we held first up yesterday morning, because this session is really about taking sort of those insights of how we approach to understand the lived experiences, the unmet needs and the opportunity to service our populations. We've got a few speakers that are going to come up and speak to us. For those who don't know me from yesterday, my name is Kathryn Huntley and I'm a member of the CLL Advocate Network SteerCo. It's my pleasure to introduce two team members from PICA company. PICA have been working with CLL advocates and other advocate networks as a not-for-profit I've just gone blank. Research group, and I have Sarah Gunn here who works in the project team and is accompanied by AJ, and I'm going to ask both of them to deliver some content to you all around the analysis of CLL-specific data that came out of the broader global survey that was conducted in 2023. And Sarah and AJ, news to you. When you finish speaking, I ask you to take a seat on the stage, if you may. So welcome.
Hi everyone. Should I stay far away from that one? So today we're going to go through some of our analysis and findings for the 2023 Global Leukaemia Experience Survey. We're going to focus on CLL-specific findings, on unmet needs and prioritising recommendations for action. So this presentation is a summary of a full research report which will be available shortly on the CLAN website, so please do keep an eye out for that. It should be in the next few weeks it'll be released. And if you have any questions once you read the report, please do get in touch with us via email. There's all the information you could possibly want on the analysis and the findings that we've got in the report. So just a brief background on the survey. In 2023, PICA were commissioned by the Acute Leukaemia Advocates Network, CML Advocates Network, and CLL Advocates Network to conduct a global leukemia patient and caregiver experience survey. The aim of the survey was to provide understanding and insight into the experiences of the patient and the caregiver rather than from a clinical perspective. It was available to patients and caregivers aged 18 and above, directly or indirectly affected by a diagnosis of leukemia. It was available online to complete in 13 languages, and it was promoted via email, online forums, social media, newsletters, and through active content to network members by the 3 advocacy groups. We received responses from 69 countries across both patients and caregivers, but we received 2,260 patient responses, 846 of which were from people with CLL. So with this data that we collected from the survey, we conducted a targeted analysis into diagnostic pathway, including active monitoring, to immunity status or knowledge of immunity status, and involvement in treatment decision-making. So from our analysis, we have come to these recommendations for clinicians and advocacy groups, which after spending the last 2 days with you all, probably won't be much of a surprise. So our recommendations are to enhance symptom awareness, improve diagnostic clarity, enhance communication and support for active monitoring plans, focus on person-centered immunity status education, and strengthen involvement in treatment decisions. So I'm going to hand over now to AJ to take you through the results in more detail.
Thank you, Sarah. So, AV team, I'm on mic 3, I think. Brilliant. I don't need to shout. So, Sarah's just told you our recommendations. I'm going to tell you how we got to them. So, without further ado, I don't really know anything about CLL. I'm an analyst by background, an insight person. When I saw some of these results, I was really shocked. You might not be, but nonetheless, 69% of people experience symptoms before diagnosis. 89% of those people didn't know that those symptoms could be due to leukemia at all. That shows there's a huge knowledge gap, right? Just first up, straight away. Nick and Kathryn asked us to look specifically around the diagnostic pathway, so we were looking at this. Most people were talking to an HCP, a healthcare professional, within 3 months of symptoms, so 49%. However, some people waited 20% of people waited more than a year to do that. Most people were seeing an HCP, a healthcare professional, once or twice before those symptoms were diagnosed. And most were diagnosed within 3 months of having first visited that healthcare professional. However, there were some people that took more than 2 years to receive a diagnosis. And much more worrying than that is that actually only 43% of people said that the diagnosis they were given was given to them in a way that they could completely understand. And I think that's quite a shocking thing, really, in terms of this. I know it's a complicated disease from what I've heard from you all, but nonetheless, that is quite a telling thing here. And we'll see that issue of communication come up time and time again, and for the larger surveys that I'm involved within England, I see that communication is a key and critical aspect, and it's something that we really pick up on. Looking then at the active monitoring pathway, most people have ever been on active monitoring. That probably isn't a surprise to you. Most people answering were also still on it. Most people also said they completely understood why they were placed on that, but it's only 59% of people said that. So there's 40% of people out there who did not understand completely why they were on active monitoring. 47% also were not as involved as they would want to be. Sorry, 47% were as involved as they wanted to be, 53% were not as involved as they wanted to be, and 25% of people were very concerned about being placed on active monitoring. Again, this is probably related to not understanding why they're being placed on it or the diagnosis in the first place. Most people are being monitored in hospital, most people are self-managing their pain, but only 45% of those people said that they were definitely confident about recognizing the progression of their disease. So there's a huge aspect around knowledge gap again here. How does that contrast against the other types of leukemia that were in the survey? So we had 846 people with CLL answering, we had the remaining 1,600, maths in my head, from other groups. Now, compared to those other leukemia types, typically ALL, AML, and CML, CLL patients were more likely than statistically expected. So statistically expected is just a fancy way of saying, you know, if everything happened by chance, right? So we're not saying that this is a good thing, we're just saying compared to that by chance. CLL patients were more likely to not experience symptoms before diagnosis. They were more likely to wait more than 2 years to speak to a healthcare professional from the first point of experiencing symptoms. They were more likely to visit a healthcare professional more than 4 times before a diagnosis and wait more than 2 years from first speaking to an HCP to receiving that diagnosis. And equally, they were far more likely to say that they were not having their diagnosis explained to them in a way that they could understand. And that's across the globe with predominantly UK and US responses, okay? But we have answers from across the globe. A little bit of a more complicated slide here, and this one's just straight out the bat. We're waiting for full confirmation, but if you know your immunity status and thus your risk of infection, is your quality of life good or bad or otherwise? Well, compared to people who were not given clear information, you're more likely to have a lower quality of life by a measure called the HM-Pro-A score. We can talk about that in depth at some other point. Just assume it's a measure of quality of life that's pretty comprehensive. It's got a good background behind it. Not only that, patients who received complete information about the protocols for CLL immunization and vaccination, about what they should and shouldn't receive, they were more likely to have a quality of life that was higher by this same score. Now, what's really interesting is that in most surveys, we see that if you have no information, you have a low score. And if you have some information, you have a slightly better score. And if you have lots of information, you have the best score of all. In this case, getting partial information, those people were often about the same as those people who got no information at all. So don't give some information, give all the information, and give it in a way that can be understood. That's the kind of simple stuff. We're going to move on to another thing there that we wanted to look at. Can we classify and predict the experiences of treatment decision-making? So essentially, if you are asked, were you involved as much as you wanted to be in decisions about your treatment, I want to know if I can probably guess your answer before you've answered me. We used a fairly sophisticated model. It's called Machine learning, I don't go into it now because we don't need to bother with that. The point is that we had a model that actually performed pretty well. This AUC number of 0.76, we want that to be as close to 1 as possible. If you're a clinician in the room, you want to see an AUC of about 0.8 or higher typically. But to give you an idea, this is a pretty good model when you're dealing with complicated survey results. And it's essentially a series of decisions, like this tree here. So we start off and everybody's in the top box. We move through one node, we split the data, and we do that a lot. Okay, it's a machine doing this, not us. What that allows us to do is say, of all the other variables that we've got, of all the other things in the survey, what is useful at classifying this? What allows us to say, were you involved in your decisions about your treatment as much as you wanted to be? What comes out as the top 5 things are these questions. Were you offered a choice of treatment options? Were you involved as much as you wanted to be about decisions about being put on active monitoring? How often have you been impacted on your sense of emotional well-being since your diagnosis? General anxiety? How long ago was your most recent treatment? And were you given clear information about any side effects from your most recent or current treatment? Those are the kind of things that are most likely to be predictive of you feeling like you have been involved. I don't think any of those are particularly surprising, but some of the effects in here are not necessarily where you might expect them to be. I'm going to hand back to Sarah now, though.
All right.
So, put her on the spot. That's the results, but what does it mean? What are the findings? Why are our recommendations being made? So.
Thank you. So yeah, just to circle back to the recommendations that we started with. So it's been a pleasure listening to all of the initiatives that you have put in place in the organisations that you work in. And I think you're already probably doing a lot of actions to tackle these recommendations. So for example, in a workshop earlier, we heard from the organisation in Brazil about a stamp that they have that has their organisation's details. And they give these to clinicians who can stamp paperwork. They're easily signposted to a patient organisation and further resources. It takes no time at all for a doctor to stamp a piece of paper. So when clinicians are saying, we're really pushed for time, we don't have enough time with patients, we don't have time to provide more clarity about diagnosis, we can think of these creative ways which we can make that process simpler, which are already being put in place. And we also seen yesterday the leaflet from the UK, which had all the immunisation and vaccination information that can be shared with GPs and can be shared with patients so they know themselves, don't have live vaccines if you have CLL. So basically, what encompasses these 5 recommendations is information and communication. So we need to educate patients, we need to educate primary physicians about what CLL is, what symptoms to watch out for, when patients should be presenting to primary care in the first place. And we really need to close those gaps of knowledge. And then also we can always improve our communication at each touch point that we have with the patient throughout their journey, because you'll see this is from even before they're presenting all the way to when they're receiving treatment. So at all stages of the patient journey, there's gaps that we can address for improving our communication and information. But I think that's everything from us for just now. So yeah, thank you for the work you're already doing.